Recording in progress. Okay, everybody. So this is episode number 4 of the Redefine Health Ed podcast. I'm your host, Katie O'Bright, the owner of Redefine Health Education. And tonight, or today, whenever you're listening, at the time of this airing, it's the evening. Okay, dang it. So we have the 2 educators of a course that's coming up in a couple of weeks. Dr. Mike O'Hara and Dr. Mike Steimling. So the course coming up in a couple of weeks on Saturday, June 19th, from 9 a.m. to 12 p.m. Eastern Standard Time. For those of you who are not on Eastern Standard Time, you're going to have to know that it is in that time zone, so adjust accordingly. We have Paying It Forward, the why, what, and how to mentoring students and young clinicians. This is an extremely important topic. And it's really something that pretty much any clinician is thrown into most of the time, thrown to the wolves. Like you're a year, maybe even not a year out of school, and they're like, here, you're getting a student next week. Figure it out. Or maybe you're a new faculty member and you've never really worked with students before and just trying to figure that out. So I am going to introduce, first I'll introduce my pal from PT school at Temple, Dr. Mike O'Hara, who is now full-time faculty at Temple University, which is kind of funny. I think it's hilarious. So Mike O'Hara, will you just give us a little introduction, and then we will introduce Mike Steimling.
Yeah, sure. Yeah, thanks for having me on, Katie. So I've, as you mentioned, I've been a faculty member at Temple a little over 3 years at this point. My primary involvement within the program itself is within the musculoskeletal course series, some foundational courses, human anatomy, biomechanics, and some elective-based courses. I'm also an instructor within the orthopedic residency program at Temple, and have some involvement in some other initiatives within the university. I maintain clinical practice with Good Shepherd Penn Partners in University City, which is in West Philadelphia. And I'm excited to be able to talk a little bit more about something that, as I've started to not only, pick up on these things within my own clinical practice, but then certainly as an educator, being able to, see the different types of mentorship and the role mentorship has on the development of students and on some of the residents, to talk more about this topic with you.
Cool. What are you teaching at MSK now? Like what?
In terms of course sequence or content?
Content. I'm just curious.
Yeah, so at least for this summer, the primary focus is within the lower quarter, hip, knee, ankle, foot. In the fall, it's the upper quarter, shoulder, elbow, wrist, and hand. And then the spring is the spine. And in terms of, kind of content areas within that, it follows a fairly similar model to way back when to our PT days, obviously updated for 2021. But what's interesting is, things like COVID and transition to distance-based learning, and as things now start to, kind of level out in the middle, working on different types of, assessment tools, formative, summative things, different clinical simulations, things to diversify the ability for a student to learn, and then also demonstrate a grasp of content in preparation for when you're right in the clinic again.
Mm-hmm. It's been a hell of a year with COVID. I was sort of doing some adjunct stuff at Pitt throughout the whole thing, and man, I really feel for students, but I really feel for faculty.
Well, and I'm sure Mike could attest to this too, is, I mean, there's no question with all that stuff, right? But I feel like I try to see the silver lining in this. And I think what it does is it's kind of challenged a lot of educators to really push their own skill sets and to develop, maybe alternative strategies and to be creative. And I think that some of these elements should be there to stay, be able to implement, and that it's provided a wide array of opportunities for students to engage in content simply outside of a lecture.
Definitely. And so I actually did EIM's hybrid teaching and learning certification pre-COVID.
Mhm.
And I'm so glad that I did that, because otherwise, I guarantee you, we wouldn't be having this conversation right now. Because if I didn't have all of those skills to figure out how to educate in a virtual environment, or in an asynchronous and an asynchronous virtual environment, I probably would not have done what I did with Redefined Health Education. So, without further ado, Mike Steimling, will you just give us a little tidbit about yourself?
Yeah, absolutely. Um, I recently transitioned into a full-time faculty role at Moravian College, soon to be Moravian University, as of July 1st of this year. We started a physical therapy program, and our first physical therapy students started on Tuesday. So, in the courses, I'm the primary instructor for our musculoskeletal content, and then I also help in some of the primary coursework like anatomy and biomechanics.
Awesome.
Yeah, Dr. O'Hara and I worked together at Good Shepherd Penn Partners. We started together many years ago now, it seems. And while I was there, I served in clinical education as the director of clinical education for that site. And during that time, I think I learned a lot about educating. I learned a lot about the gaps that there currently is in the model of how we educate PT students. We put a lot of effort on the didactic side and the classroom side, but then a lot of times when we get out to the clinic, it's just kind of maybe the luck of the draw of where you land. And there's some really good educators out there, and there's some maybe not so good ones, and a lot of people in between. And it's not necessarily something that comes to people naturally. Some people it does, but a lot of people it takes time and practice to get good at it, just like anything else that we do. And sometimes having some intention to why or how we do things can go a long way.
So I'm really curious, because I know what it was like when I was a PT student, in terms of like kind of just find, I actually found some of my own clinical sites because I wanted to go into the army, and I wanted that specific experience. So I went out and got, made some contacts with people that Temple didn't already have in place. And it wasn't like Temple reached out to the specific clinical instructor that I was going to be working with and said, "Hey, are you skilled to be a teacher or to be a clinical educator?" And I know that that's something that is really difficult to do, or really challenging. But I'm curious what you guys are doing now as faculty to maybe help to bridge that gap for clinical educators, or what is the landscape like now? I don't even know.
So in terms of Philadelphia, so when you were there, there's many PT programs. So that it's a very PT dense area
Yep.
of the country, and there's only so many slots to slate a student. So that tends to be one of the challenges. And I think this past year may be a tough comparison with the fact that COVID, essentially shut not only just some of the clinical internships down, but some of the clinics, unfortunately, or at least temporarily. So, but that being said, I think out of some of those things came, telehealth and opportunities for students to speak with patients and to be able to, be able to provide care under the conditions that we were all, with the cards we were all dealt.
Mm-hmm.
In terms of how those things are starting to look a little bit more recently now, might predate COVID to a degree, but just having one competing for different slots, two, then it's on the clinician or on the actual clinician side of things.
Mm-hmm.
Are they resourced sufficiently enough? Do they have enough time allocated to educating their to take on a student with the own pressures a clinician may have regarding, anything from productivity to,
Yeah.
simply just day-to-day operations. For your point about an educator and how do we tease that out based on a site versus individual? I think that's something a lot of programs, have to juggle and wrestle with a bit, in that, sometimes there are, different clinics that may have a really strong teaching base from their clinicians, or have a strong clinical base that a student would benefit to go. But the band doesn't always stay together, and if other clinicians do venture on, That's something that, at least within our program, when it comes to our integrated clinical experiences for students, we've started to lean on more, in that who are high quality clinicians, not only, but those that have that skill when it comes to educating a student that comes in there for the first time. And those are some of the individuals that we've been able to loop not only into some of our clinical internship and integrated clinical experiences, but also if they were to be a teaching assistant in one of the courses, or have another type of adjunctive role, to be able to provide a wide variety of opportunities to students to work with those folks.
How do you assess that? Like, how do you, when you're, I know, are either of you in a DCE role right now?
No.
Okay. Or assistant DCE. So I'm really curious about, maybe I should have an episode where I just interview a bunch of DCEs, because I feel like their job is insane and I would never want it. And I respect the heck out of them. So I'm curious, like, how would you assess that? Or if you were in a DCE role, and if we were in a perfect world and you were able to select, this is the perfect, or this is the ideal clinical educator, what would it look like and how would you assess it?
Go ahead, Mike. I think you'd be able to talk to that well with your experiences at Good Shepherd.
So I guess one of the things that we are working on and developing, and I won't take all the credit, I won't take any credit for this. This is our DCE, Dr. Allison role, but one of the things that she's trying to do is develop a system in which we have repeat clinical instructors. And so our contracts with a site are really with the contract with a clinical instructor, so that instructor is taking a student in a similar place in the education every year. And so they get, number one, repetitions.
And actually, that is really smart. Sorry, go on.
No, yeah, absolutely. And I think it's a great idea. This idea that we can have people that we can really lean on and rely on to be good clinical instructors for us. They get more repetitions with it, and they get repetitions with the program and the students that come out of that. We're also in an area that is slightly more rural than Philadelphia. We're in the Lehigh Valley, and there's a little less competition. So it's a little easier for us to some extent, because we maybe don't have so many schools competing for all the same slots. So it's a slightly more unique than potentially Temple or the other Philadelphia schools. As far as assessment, I think this is one thing that's really challenging. We get feedback from students clearly on the performance of clinical instructors. And even to some extent, a student may not know the difference between good and bad if they haven't had a good or a bad experience. So just their subjective experiences may not be enough to evaluate the true effectiveness of a clinical educator.
Mm-hmm.
So I think in a lot of ways it comes down to our experiences with them and trying to include our clinical instructors within our program so we can all be working together and then get a better sense of how we're teaching together, really bridging the gap between our clinical education and our didactic.
And how much information does a given clinical instructor get about your curriculum? So for example, if I was going to take one of your students, would I have to reach out and say, what do they have? Like, what is the expectation? Because, therapists practice on all different levels. So yeah, I'm curious about that.
Yeah. And this comes from my experience currently, but also when I was serving more on the clinical side, many of the schools would actually send essentially like an education packet of information about where they are in their curriculum, what classes they've had to this point, what clinical experiences that particular student has had to that point, in addition to some of their goals and aspirations. Sometimes it's a handwritten, not a handwritten letter anymore, but essentially a personal letter or a personal statement. And which I think fills in many of the gaps, as long as that information is conveyed to the clinical instructor in a timely manner.
Yeah, sometimes that can be a challenge, as we all know. Sometimes I remember when I was at Fort Sill, we took a lot of students from Oklahoma and other surrounding universities down there, and sometimes it'd be like a couple days, and they'd be like, "Oh, you're getting a student. Can you take a student?" I can. So So I'm curious, honestly, why you guys both felt passionate enough to choose this as a topic for a course. What are some of the stories and things that you've seen that made you want to put a course together on this topic? Of all of the topics in the entire world in our field, why this one?
Yeah, it's a great question. So I think the one of the big things was the idea, and this is, um, you know, Mike and I, whether when we were working together, would always be talking shop about one idea or another. And I think one thing that had been a thread is some of the strong mentorship we had when we were in that clinic and prior to us being there. A lot of role models what we had, and that um, the idea of paying it forward is always something personally to me that's been kind of like the North Star to why I do what I do. And I think when it comes to a clinical skill set, of course, that's great. But then it's kind of, more about, well, is there, if we think about how to effectively treat a patient, can we think similarly about how to effectively mentor somebody? So it started with ideas about, what is mentorship? And I was polling folks in my clinic or what they thought were positive experiences, negative. Why was that? Why do you think something works well? Why does not, something not work well? And how should we go about it? So, kind of the tagline with it is the what, why, and how. So it was some of those experiences previously, and some things that I've been then, within my role as an educator is working with a variety of students that, it requires a student centered or a young clinician centered approach where it's, yes, there's kind of a foundation of, or benchmark a clinician should be capable of, but at the same time, when you're teaching a class, you're not just teaching the top half, you're teaching everyone in the room, and how do I individualize and develop a plan that strengthens all folks that you'd work with. And when you're taking a student on, what thing that I was interested in is how that isn't as much of part of the conversation is. And when it comes to looking at Con Ed courses, how many are there on this topic? It's fairly easy to find ones on low back pain or shoulder pain or whatever it is, and they're fantastic. Mm-hmm. But I think what interested me is that there's a void, especially within PT. So some of this was, organically through experiences, but then some of the interests that Mike and I have is kind of, and the roles that we have now, kind of steered us to this. And I think even, being involved with a variety of different programs and talking with Mike and putting this together, it's been a fun journey into this topic as well. And I'm looking forward to sharing it.
I'm looking forward to seeing what you guys put out there. What about you, Mike? Is there anything you want to add to that at all?
Yeah. One thing I would say is taking me down this whole path of education probably started with my own desire for knowledge shortly after coming out of PT school, and not wanting mentorship, but not knowing really what it was. And the things that I probably wanted at that time would be a lot different than what I might have given myself now if I could do that. And so I think, and Mike and I both obviously sought full-time educator role. So this is something that we're clearly passionate about. One of the things that I think has always excited me about the prospect of mentoring or educating is how engaged it keeps you in your profession. It is one of those things where mentoring can be career long, either being a mentee or being a mentor. And it is something that I think when you watch the people who participate in that on either end, you see them just operating at a level that is much more engaged or much more deliberate and mindful of what they're trying to accomplish. And I think to some extent that is maybe one tool to avoid many of the trends towards burnout we see in healthcare, is finding ways to stay engaged in what you're doing, and educating or getting educated are ways to keep you interested.
Yeah, absolutely. And on that note of burnout, I was actually going to come back to the point that you made about partnering with clinical instructors instead of just facilities. So you have these designated CIs that are just awesome and know what they're doing, and you really like working with them. How much is there any different setup that those clinical instructors would have? Because I could only imagine, after having a student for X amount of time, maybe not at this point in my career, but probably earlier, it's overwhelming having a student sometimes, and it can be really taxing and really, you devote all of your time to teaching the student and making sure that they have it right, either the student in PT school or new clinician. And then you still have to do all your notes at the end of the day, make sure your stuff is done, and then get home on time. And I can only imagine that would be one of the things that might contribute to burnout. So how do you manage that? Is it something that like you only have a certain number of cycles per year, or tell me how that works?
Yeah, I think that's key, is that, that there are breaks where maybe you just get to do the 9 to 5 gig for a little bit versus always having to be putting in that extra. And I do think that there's elements where students, while they increase workloads on one end, they can help decrease workloads on other ends. Obviously they're helping with patient care, they're obviously helping with documentation and stuff like that. So there's a balance. I think obviously it's usually front loaded where the clinician's putting in longer hours in those first couple of weeks, but maybe towards the end it starts to balance out a little bit, and maybe it doesn't feel like, for lack of a better word, a burden on the clinician, and the student starts to be able to take on a little bit more of the responsibility. But I do think that it's important that there are breaks and that they get an opportunity just to maybe settle into what you might consider the normal 9 to 5.
Yeah. Speaking of burnout, this is just a little plug here. Perfect conversational lead into this little commercial break on June 14th, which is the Monday before Mike and Mike's course, Dr. Mike's course. On June 14th, Dr. Ari Ginsberg is going to be teaching a 1-hour course called The New World of Rehab, Addressing Burnout. So Dr. Ginsberg is a physical therapist, but also a psychologist. And he is going to be talking about the psychology of burnout, how it actually affects our brain and nervous system, and how the rest of our body actually kind of shuts down when that happens, and how to address it, and how to make sure that we don't become victim to that, where I was like circa 2017 when I wanted to leave PT and open my own food truck. I swear I had the plans. I had it all drawn up. I was like, I'm not going to be a PT anymore. But here, I'm still here. So yeah, a little plug there on burnout. And coming back, I am honestly curious. So what would you say, either one of you, what would you say to the person, because I know there's a ton of them out there, the person who doesn't want to be a CI, they don't want to take a student, it's too much work, it's not what they signed up for, it's the people that are coming out of school and they just want to see patients and nothing else. There's a ton of them out there. There's not a lot of people who like are ready and willing to take a student. So what would be like your first thing to say to those people?
Well, I mean, I suppose there's, and I can totally understand that perspective, and I think that's okay. I don't necessarily think someone should be pigeonholed and have to do something. But I think maybe what I would do is have a conversation is that mentorship doesn't only look one way. It can look a lot of different ways, and there's flexibility when it comes to it. If this is something that, maybe the clinician is got to get through their day, has to get home to a new baby, or has something coming where I can't hang around, but hey, I could come talk on Zoom, at night, and that's easier for me. So I think it would probably be underpinned by communication and to realize, what are things that are fulfilling about what you do as a clinician, and I think there's a lot of room for being a mentor. I don't think it looks only in a pure clinical role. Mm-hmm. Could be research based. Maybe it's someone who enjoys or has a skill set in putting content together for, let's say, a submission to CSM or something. Whatever it is, I think there's a wide variety of roles, and I think for a clinician to understand there's a lot everyone can contribute, I think is half the battle.
Yeah, for sure. Anything you want to tag on that, Mike?
Yeah. One of the things I think as physical therapists and rehab professionals as a whole, we offer a lot of really cool interventions. But one of the things that is probably most powerful and something that we all generally speaking, do very well is we're patient educators. So we serve as educators primarily. And so the idea of educating a patient and then potentially educating a co-clinician, to me, isn't that far off. And while maybe some of the things that you do or how you interact with that individual might be slightly different, they are very similar. And I think Mike and I hope to paint some of those similarities in the course.
I'm so glad that you brought that up, because that's one of the things that I was really thinking about initially. Like, one of our primary roles is to educate patients on what's going on with their bodies and how their bodies work. And another thing that I'm learning right now, so I'm in my fellowship right now, and I'm taking this pain science course, and I'm just like blown away, because it's like pain science reframed. I've seen and done pain science 100 times before. I mean, Mike and I had it back in PT school, and I think even at that point, it was kind of still early on. But anyways, this course now is like totally restructuring my way of thinking, and a lot of it has to do with assessing the patient's kind of their stage of change, and if they're in that contemplation, or if they're kind of contemplating change, and how you as a clinician can respond to what they're giving you. And I think that for clinical education, I almost wonder, for the people that don't want to take a student, or kind of have this sort of feeling toward it, why do they feel that way? And I would almost want to sit down and have a conversation with them about, like, is it like, what is the barrier, and is it because you really don't like what you're doing, or is it because it's just too much time? And then how can we break down those barriers to figure out how you can actually enjoy being a mentor, instead of having it be this like overly taxing, overwhelming thing, which it is sometimes. I don't know if you guys want to.
I think that's an awesome point. I actually don't think I thought of it within that context before, but yeah, it's dead on. And it's exactly what we deal with or struggle with our patients often is, when are they ready to hear what information we want to give them? And to some extent, maybe that's about having more in-depth conversations about all of those barriers you already mentioned.
I feel like we all could learn a lot from psychologists. Because a lot of these things that we're talking about, a lot of these strategies, especially with patient education, come from like cognitive behavioral therapy strategies and motivational interviewing. A lot of that was really originated in the psychology and behavioral health world. And I think I use these strategies. Well, I certainly use them on myself, but like I kind of use them on my kids too sometimes. And I think it's too easy to figure out how to do that. You just do it in a different context. Anytime you are trying to teach somebody else, or anytime you're trying to figure out where they're at, you can use the same type of strategy. So having that overlap, I think, or demonstrating that there is a significant amount of overlap there, is important. And I think it's something a lot of people don't really think about. Also, a plug here. Excuse me, because we're talking about it. It's just happening organically, which is exactly what I wanted it to be. Speaking of patient education, the ladies from Physio Sage, who are awesome and excellent partners, their whole mantra is patient education. They feel so strongly about it that they actually started their own business and their own company dedicated to helping clinicians become better patient educators. And they have their whole patient education summit, the very first inaugural patient educator summit, on Saturday, June 12th. You can see all the information for that and sign up for it on my website at redefinehealthed.com. Man, this is just rolling, like, so good. But anyways, I'll let you guys circle back to that topic if you so choose.
No, and I think just one last thought on that is just, I think at its core is, like, you mentioned, is communication, and that, whether it's between a mentor and a mentee, a clinician and a patient, any other staff member, I think that's really something that, that is the ultimate bridge between a lot of these things. And, like, I think you bring up a great point, Katie. I think it's just finding ways to use some of those techniques and weave some of these things together in a way that allows you to really, if it is that clinician who has some hesitation or imposter syndrome or whatever it is about taking a student, or trying to connect with that student or try to connect with patients like we do every day, so I really agree. I think it's great.
I interviewed Colonel Jason Silvernail, who was a mentor of mine. So episode 2 actually was all about leadership and his experience in military leadership, physical therapy, military leadership. And one of the things we talked about was, and actually we recorded this last summer and I just got around to putting it all together now. But he was talking about how in PT school or in any kind of professional school, graduate school or medical school, whatever, you learn your trade. Like you're there to learn your trade, and you're not necessarily there to learn how to become a leader or to lead. And the more I listened to it, I listened back to it and I kind of reflected on it. And the more I almost think that these parallels between us being able to educate, we learn how to educate our patients and we learn the skills, the basic skills to how to do that in PT school, and how much does that overlap to being able to educate somebody else. And I almost wonder if in PT school we should have better overlap of those topics. Like, hey, you're probably gonna at some point in your career take a student, or you might be a manager of a clinic or a supervisor. How well can you communicate with your staff and with your students just as well as you can communicate with your patients? Do you guys see any of that maybe happening, or would you?
No, I think that's a fantastic idea. Over the last couple of years, Bill Egan, Scott Burns, and we started to implement a little bit more on the, communication side of being a clinician. The idea of simply doing a patient interview has been bolstered a bit. We've included what we jokingly call speed dating, where you're given a quick scenario and you got to talk that through with a patient, with the patient's spouse, with whatever type of clinical scenario that's presented. And they're typically meant to be a challenging scenario where in a safe environment I can be clunky and fumble my way through, and then reflect on it. And then think about, okay, what about that went well? What do I feel like I struggled with? And when presented in a clinic, how might I do that?
I think that's great. That's awesome.
It's been pretty fun to do. And in addition to some of those things, within the university, there's been more opportunities for clinicians or students of different professional programs to interact and to be able to talk about their own skill sets and what they bring to the table for more kind of an interprofessional approach to patient management. And I would say, we were talking about augmentations to various assignments. We've included some. I do like your idea about having to dole that out as a mentor, but we've had others that are in similar respects with perhaps other folks within a clinic and how to effectively communicate to future colleagues, even as a student. But I think that's a great idea, and I might steal that.
I'm here all day. I'm here all day. And I'm always here as a consultant, so you know that. Sure. Free of charge, Mike. Free of charge.
Yeah.
Yeah. So I am really excited for your course. I think it's going to be great. I think it's a really important topic, and I hope that other people are finding that. I mean, you guys have gotten, I'm going to tell you already, have gotten a ton of web traffic happening over your course, which is great, which is exactly what I'm hoping to see. Because it seems like a lot of clinicians now, like I think Mike, you and I talked about this, clinicians now, they lean towards like the sexier continuing education, the stuff that they can kind of like wave around like magic wands when they go back into their clinic and be like, hey, I got this cool little fancy trick. Well, really what I'm learning and what I've always really known, but what is being even more reinforced now that I'm in this fellowship process is you become an excellent clinician and a much better patient educator, patient communicator, and ultimately you will have better outcomes if you learn these basics of how to be like how to communicate with patients. And a lot of that comes back to working and communicating with students and clinicians. If you have all of those things down, you're in pretty good shape. So I'm definitely excited for the course. Do you guys want to give any little previews on what's going to take place? Give a little rundown of the goods.
Sure. I could give a little bit. So Mike and I have divided some of the content for this course, where I'll cover the what and the why, and Mike will be able to talk more about some of the experiences he's mentioned today, and I'll let him, he'll be able to tell you more in a moment. When it comes to the what's and whys, the what is just looking at the 30,000 foot view landscape of mentorship. Looking at the different types of models, the strengths, weaknesses, opportunities, and threats, kind of like a SWOT to what this looks like. Being able to, pose different types of ideas, and kind of think about, okay, well, here's how mentorship is done now. Are there ways that we can get better at this? And if so, what is an opportunity, or what are things to consider that may optimize our role as a mentor and have as positive experience for our students? And then when it comes to the whys, is it provides more, kind of your rationale as to why that may be a productive route to go. We'll talk more about how individuals learn, how individuals may best learn, and what are ways that we can be introduced to our student or clinician that's a new hire, and be able to develop a plan effectively and think about things like clinical decision making, pattern recognition, and what role that has within mentorship. And that sets up to Mike's stuff.
Yeah, and I'll be covering a lot of the house, and we wanted to present it in a way that we want this to be valuable to the CI who is taking their first or their 10th student, but also to maybe a new clinician who's seeking out mentorship, as well as maybe someone who's thinking that they might want to be a mentor to new clinicians coming into their clinic. And we wanted to show a number of different ways in which you can serve as a mentor to someone who's developing, as well as to maybe have a better understanding of what you should want out of mentorship, and maybe how to develop it and how to get there. Sometimes I think even if a lot of new clinicians, and I speak from my own experience, come out and they really are craving it, but the people around them may not know how to give it. And so maybe even just learning what you want can then facilitate a relationship with someone that can actually be very rewarding, even if they are at this point or at this juncture an expert mentor.
Yeah, I'm so glad that you brought that up specifically, because I think even just looking at the course title, it seems like this course would be more geared towards individuals that are already clinical instructors or in a mentoring position. But if this is also expanded or opened up to individuals that are kind of on the flip side and looking for mentorship, how do you even know what you're looking for? So I think that the fact that you're going to bring that up in this is great, because a lot of people don't even know what they want or the type of person that could be a good mentor to them. Sometimes you think you know what you want or you need, but it's not necessarily all there. So that's great. So Mike, you're expecting a baby pretty soon here, right?
Yeah.
When's baby due?
2 months. Yeah.
2 months already? I feel like the last time we talked, dude, you guys just found out you were pregnant.
And time is flying. Actually this weekend is the baby shower, so it'll be a fun weekend, and no doubt I think it's something that obviously my wife and I are super excited, looking forward to it, and yeah, it's going to be no doubt a summer to remember.
For sure. Oh my goodness. So do you guys know what you're having?
We do, a boy.
Awesome. Okay. Though you might end up like me someday and just be overtaken by men.
Yeah. Christina, between myself, our future son, and our dog, she's the only female in the house, but she keeps us in line.
Hey man, I feel you, Christina. I feel you. What about you, Mike? I actually don't even know that much about you. For everybody listening, this is actually my first my first real introduction with Mike Steimling. So what is your situation?
Yeah, my wife and I moved here to Bethlehem about a year ago in the midst of the pandemic and bought our first home here, which is exciting. It's been a wild ride, especially in this housing market, if you've heard anything about it, but it's been crazy. But we're settled, and we're looking forward to a relaxing summer.
That's great. Yeah, life is, everybody knows that we just moved to Chicago, literally a week ago. And this is our second move in 2 years. So our first move from Oklahoma to Pittsburgh, Jimmy and Hunter were 1 and 2. 1 and 2. Is that right? Oh my gosh. Yeah. And now they're 3 and 4. Oh my, I can't even keep my head straight. So, but like moving across the country with a 1 and a 2-year-old and then a 3 and a 4-year-old, guys, don't do it. don't do it. It's not a smart move.
I'll keep that going.
Okay, so now we're going to close out. I am going to ask you guys my would you rather questions that everybody loves to hear. Would you rather always say everything on your mind or never speak again?
Ooh. Is that for me or Mike?
You know what? It's for both of you. So you got to both answer.
Okay.
That's a good one.
Well, I think it might be challenging to do some of the things I enjoy doing without talking, but I may have to try to work on agility so I could run from people if I'm saying what I truly think all the time.
So, okay, just a little backstory. Mike and I went to PT school together. We were in the same class, and it would be hilarious if you said everything that was on your mind all the time.
You've gotten probably a taste of that, but
just a little bit.
Yeah, no. I think, I guess if I had to pick between the two, take the good with the bad.
Just say it all. Say it all. I'm probably with you on that one. What about you, Mike?
Yeah, I'd be fine just being the most honest man in the world.
See, some people would be like, I don't know about that. And then just, write things on a dry erase board or something. Okay. And second one, would you rather be a kid your whole life or an adult your whole life? Start to finish. That's a good one too.
Yeah, I feel like my gut hearing that question, I would say kid, but I think with, baby on the way and some of the exciting things that my wife and I have been able to do over the last couple of years, I think that, for how things are going now, couldn't be happier. So I'm going to say adult.
Good answer, Mike. How about other Mike?
I didn't drink much beer as a kid, so I'm going to go with the adult.
Adulting is kind of, it has its advantages. But hey, being a kid does too. I mean, I watch my sons run around and they don't have a care in the world. They don't know any better. They just kind of run around, live their lives, and everything is provided for them. And
they don't need the beer yet.
No, I think I'm pretty satisfied with being an adult, but the older I get and like the more we're done having children, but adding children into the mix, it definitely makes things like beer a little bit more necessary and good that we can take advantage of it, right?
Well, it would make the speaking your mind thing a little easier if you were a kid, because maybe understandable in certain conditions. As an adult, less likely. So I may have to change my answer.
Like, the older people too, though, because they say whatever they want. It just is what it is. So
summer of wiffle ball, street hockey, and golf. I wouldn't mind too.
It could go either way. All right, guys, great episode. Thanks so much for hanging out. For anybody that is interested in taking the Dr. Mike's plural course, it is again on Saturday, June 19th, from 10 a.m. to 12 p.m. Eastern Standard Time. It's going to be a great course. Sign up on the website at www.redefinehealthed.com. Follow us on all the social medias because we're on all of them at Redefine Health Ed. And that's a wrap.